to get out into the community and talk to people. So my name's Lauren. I'm from Fawcett Memorial Hospital. I'm a nurse, but I always joke that I'm not a real nurse. I actually work in the quality department, which means that I'm sort of behind the scenes, managing data, kind of implementing different performance improvement items, and trying to make sure that we're doing the best for our patients to have the best outcomes. So I'm sort of a behind the scenes nurse now. So whenever people ask me, what do you do for a living? And I say, I'm a nurse, but I'm not a real nurse because, don't rely on me to do anything, really, but I can work in Excel. No, okay. It all is in there somewhere. But Fawcett Memorial Hospital is part of a bigger system, which is HCA Healthcare, which is the largest healthcare organization in the country. Over 175 hospitals in 21 states. And actually in our area, we are part of the West Florida division of HCA, which is 16 hospitals that go as far north as, the Tampa, Brooksville area, and we are the furthest south. We are the redheaded stepchild, furthest south. We always have to drive the furthest to
Don't we always feel that way in Charlotte County a
little bit. You would think we would maybe have something else a little further south, but we are the furthest south. So whenever they do meetings up in Tampa, it's like, well, I'll be there in 2 hours,
Right.
It's so far away.
I didn't realize how many hospitals they did have, though. That's pretty impressive.
We are everywhere. Yeah, the HCA family is everywhere. And I was joking with the girls before we got started, I'm so proud to be a part of the Fawcett team. Fawcett has not only given me a job, but it's given me a family. We're all, it's cheesy, but we celebrate milestones together. We celebrate our families together, and we are family working together every day.
That's
so we're
nice.
really
That's
lucky.
not cheesy. That's why I say, if it's from the heart, that's
true.
great. You're a great team.
It's true.
And it shows.
We love to be together. Does that sound corny?
No, it beats the alternative because a lot of people don't want to be with their families. Unfortunately, I hear that.
Or their coworkers.
Yeah. So no, that's a big plus. That's how I feel with Chelsea Place. Same way.
Yeah.
So. That's really great to hear. It's nice to hear.
And we also, as the Fawcett family, we are expanding, which we're so lucky because, Fawcett's been so spatially challenged the last few years, where any closet has become workspace. Anywhere that we could put a desk or put somebody somewhere to do a job, we are using our space, trying to maximize it. So we've been really lucky to be able to expand. So the first thing I wanted to mention is that we're getting a parking garage, and anybody who's come to Fawcett lately, you're probably pulling your hair out because you're having to valet or try to illegally park somewhere because it's been a little challenging. We do have valet service though, guys, so please feel free to come out.
Yeah, and they are wonderful. I know right now they're building that big parking lot, which is amazing. But when you go there, the volunteers help also. Like when you're in the parking lot, they're driving around with the golf cart.
Yeah.
And they're so pleasant.
I really want that job. I asked my boss, I'm like, when can I start driving people for joyrides in the golf cart? And they were like, Lauren, you're not going to get that job.
Yeah,
but I was hoping for that job.
But also,
fun.
isn't it a lot of people who retire, they're part of H2U, the great program. So, but so pleasant.
Very, very
I
think so too. And we couldn't survive without our volunteers. So anybody out there who wants to come be part of the family, please come out. Our volunteers are practically we literally couldn't function without them. They do so much for us, and they are the first people you see when you pop in the door, smiling and asking you, where do you need to go? What do you need help with?
I've never, and no offense to any other places, but when you walk in there, they're sitting in a room,
they have
waiting for you. That's, no, I'm serious, but it's with a smile, what's concierge service?
Sounds a little creepy from this.
No, they're just sitting in a room.
There's somebody there waiting for you.
No, as soon as you walk in, it's amazing. They're sitting there. They're not creeping on you. Come on. They're just sitting there waiting to see if you need help, and they're going to help you to your destination. It's kudos.
People come
You're so too funny.
Yeah. They're not creepy. They're a delight.
Yes.
And, most of the time, people coming to the hospital are probably coming there on some of the worst days they're having. So they don't always know where they want to go or what they need, and to have a resource there to say, hey, what do you need help with? Where, can I help you find somebody? It is great. So the volunteers are wonderful, but the parking garage is also wonderful. And it's going to have a helipad, which really makes me feel like we're next level over there, right? Like General Hospital style. Like, it's really exciting.
Wait,
to
talking
have
about
a
General
helipad.
Hospital, the soap opera?
Yeah, right.
Oh, you're my kind of girl.
Right. So
it's a whole nother radio show we can talk.
Save that for the podcast.
Yeah.
But so excuse our construction, excuse our noise. We're trying to make it more accessible and easier for you guys to come and see us, whether it's as a visitor just coming in to say hey, or if you have to come to the hospital for some reason, we want to make it a better experience for you from the start, particularly when you're parking. So that's not the only expansion projects they have going on. We're opening a new inpatient unit on the second floor with 20 private beds. And I think the ribbon cutting is actually September 4th.
Yes, you have that, and then also it's that in another department, and I'm sorry, I'm drawing a blank because I just recently maybe it was a month or two ago, your other program, we went to a ribbon cutting, and they did an amazing job.
The stroke.
Yes, thank you.
Yeah, so
and showed us a demonstration.
I know, with the jelly person.
Yeah, it was
neat, right?
Wow, then kudos to Alexandria and her team. Wow, as soon as you walked in, it was nice. And welcoming. Yeah. Not just
and they had a donut table. And I don't know if you were able to focus on that.
No, that was hard not to focus because the donuts, I've never seen anything like them before.
I
they were
them home
just
to show
amazing.
My kids because I was like, look at what we've been missing out on. This donut has, it's like 4 inches high.
Oh, were they from Abby's?
She said someplace. I think it was Sarasota. Yeah.
But fancy.
Everything, it was just so lovely, and they invited the staff down. Mm-hmm. But as getting back to the volunteers, as soon as we were in the parking lot, because I was with another business associate, they picked us up, brought us to the front of the building. It was drizzling out, made sure we were all covered up. And then as soon as we walked in the door, every few feet, there was somebody directing us, and just so pleasant. And it was a great experience.
Oh, good.
Very, very nice.
So tell us more about the
more important.
The
jelly body. The donuts?
I wasn't there.
Or that.
Yeah.
Well, and I mean, it doesn't feel right to talk about donuts and talk about stroke. So I will preface this conversation with, take it easy on the donuts. We're trying to reduce strokes, right?
Yeah,
so
everything in moderation.
Everything
you could have
in moderation.
A little piece.
Absolutely. Okay. So, they actually launched the comprehensive stroke program at Fawcett back in May, and the reason why that's a really big deal for us is in the past we've been what's called a primary stroke facility. We're a certified primary stroke facility by the Joint Commission, and to anybody out there, they probably are like, well, who cares? I could go to any hospital and get stroke treatment, but the truth is it's different depending on what services that facility offers. We have different people on staff that can do different types of procedures and imaging, and ultimately, we have to transfer people if they're a higher acuity or require different care. So being a comprehensive stroke center means that we can do it all. Okay. And with the recommendations that came out from the American Heart Association in 2018, what they said was, we're going up into hearts and pulling clots out of hearts when someone's having a heart attack. Why aren't we doing that for the brain, right? I mean, we should be doing the same thing because it's best for the patient. Well, at first that seemed kind of crazy, the idea of fishing around in someone's brain looking for a clot and pulling it out. But it became best practice, and we were lucky enough to get some physicians to move to our area because finding these neurointerventionalists it's very tough difficult. Stuff.
Yeah.
So we found a group that was willing to come down to Charlotte County and help us launch this program, and now we are performing thrombectomies on our patients who are experiencing large vessel occlusion strokes. So if the stroke happens to be in a vessel that's big enough for us to fish a catheter into, we can extract those clots, restore blood flow to that part of the brain. This is for ischemic strokes. And ultimately, the patient could walk out of the hospital the next day, which, and
I can't even imagine that. That's amazing.
25 years ago even, they would say, oh, you had a stroke? Well, let's put them in a bed and assess them in a week, and maybe they'll be able to move or talk, maybe they won't. And as you know, different parts of your brain just affect different parts of your body.
Absolutely.
So these large vessel occlusions can be devastating to a person. A person who's functional and able to work might be bedridden and unable to speak. So it's truly life-changing to be able to offer that service to Charlotte County. And it's a need. It's a true need.
Right, I would definitely think so. I mean, you're helping people with their quality of life.
That's
I
right.
mean, almost like in an instant.
Yeah,
You know, it's not like a long process like you would assume.
Well, and
Yeah.
how scary. Everything with stroke is time sensitive. So
Exactly.
if we had to bring you there and then we said, oh my gosh, you're having a large vessel occlusion, let us get the chopper. Let us make sure the weather's right. Let's find another facility that can take you, that can perform this. Let's get you in the, while we try to do it as quickly as we can, it's much easier to say, let's get him in the IR suite and start the party. Like, let's do it here.
Amazing.
So really great work being done by our team, our stroke team at Fawcett. And Jan, who was unable to come today, she's too busy saving lives.
Because she's a real nurse?
She's a real nurse. She's
cool
our stroke coordinator, and she's done a wonderful job helping launch that program.
And excuse me, before we are going to take a short break, but if you have any questions for Lauren, please feel free to call in on our toll-free line at 1-888-441-1580 or direct at 206-1580. And we'll talk to you in a little while. Maybe I should have said be back in a little while. Whatever. It's great.
fine.
Oh, yeah.
There we go. Perfect. Good job.
Yeah, it's really good.
You
See
know,
what
my
see,
dream
it's
is to work
casual.
at Fawcett.
Come play with us.
I seriously, radiology.
Hello.
Yeah?
He's looking for to
X-ray,
stay in
MRI.
this.
But I
You
need
need
money to go
MRI,
to
so-
school. I need to go to school. Do they give grants? Or do they-
Yes.
I need to talk to
Dean,
someone like
hello.
Yeah, like, hello. Well, and working it for HCA in general, like, you could come in and do transport for our radiology department and then reap all the benefits of getting tuition reimbursement while you would be in school. So what I'm saying is we could
Yeah.
hire you on as like a transporter, and you can hang out and push around beds and wheelchairs.
Could I
and get to know
possibly do it in
everybody.
the afternoon because I want to keep my job here?
And you're so good at it.
I don't know about all the
Yeah,
specifics.
we'll work on that.
But there is
Yeah,
like
I'm
a
sure
great
there's
opportunity.
multiple
But
shifts.
see, like 5 years ago, they told me the market's flooded. There's no more opportunity for radiology people. Now it's not, I heard.
No.
So that's what I've always wanted to do. I would do the RN thing because I have a 2-year degree already.
Yeah,
And it's in broadcasting. But that means I have all my Gordon rules done.
yeah, you can just bridge it.
And he's amazing.
Well,
He
then,
really is.
I would, yeah, I'm a caregiver. And I gotta tell you, you guys, I don't know how long have you been with the hospital?
2014, a little bit.
In 2009, my dad was on his last days. He spent 4 months in the hospital, inside and in and out of ER, or in and out of ICU. And they took such good care of him, but he was just too sick, He was 84.
Oh, heavens.
But he broke a lot of hearts, man.
Aw.
He really did. They loved my dad. They absolutely loved him. So he wanted me to do that.
Yeah, of
He told me
course.
before, yeah.
See, you can even get a job while you're on the radio station.
Right. All right, here we go. Here we go.
It's a
Amy.
recommendation.
Okay, welcome back. This is Amy Conti with Chelsea Place Senior Care with Suzanne from
Discount Bed Direct.
There you go. And we have Lauren Sutherland here today from Fawcett Memorial Hospital, and she is the quality coordinator for the specific department.
I feel like
or how
they
you wanna-
give you the title of quality coordinator because
Yeah.
they want to be able to say, well, you're in charge of more than just this one thing. But my main end game is I mainly work with our sepsis population, and I feel like there's an opportunity to talk about sepsis a little bit because it seems like one of those things where people always have questions and they don't know what sepsis is, or they have heard of sepsis, but they have maybe a false thoughts about what it truly
Right.
means to be septic. So if you don't stop me, I'm going to start talking.
Nope.
No, but this is really good because if it's not treated, there can be some
some
terrible
severe, yes.
Sure.
circumstances.
Right. So only just in the recent history, past 10 years, sepsis has become a huge topic of conversation, specifically because CMS, so Centers for Medicaid and Medicare Services, started looking at it as a measurable performance item for hospitals.
Okay.
So, it had a high mortality rate. Somebody in septic shock, it's a progressive condition. If you get to septic shock, you're pretty sick, has up to a 50% mortality rate. So they started saying, hey man, like what's the evidence-based research so that we can treat these patients and reduce that mortality.
Well, and the mortality can be pretty quick, too.
Super quick. And that's the other scary part about sepsis. So everybody knows to call 911 if you think someone's having a heart attack. And everybody knows to call 911 if you think you're having a stroke. And I'm going to say that again. If you think someone is having a stroke, please call 911 and don't drive yourself to the hospital or a friend to the hospital because the ambulance is going to get you there faster. And something else that's interesting about EMS that people don't always think about is EMS knows which facilities perform what kind of procedures based on what type of stroke you're having. So if you are having a certain type of stroke that needs certain types of care, EMS can triage you up and get you to the right facility that will give you that type of care that you need. So call 911, don't drive yourself, it's dangerous.
Yes. I know there's a stroke letter thing that tells everybody how to know if there's a stroke.
Yeah. Oh, well, I mean, I haven't talked about it yet. So everybody knows FAST, right? Yeah. So FAST is face, arm, speech, and time. So with face, you're looking for asymmetry in a patient's face. You can even tell them to smile. If they're not able to smile on one side of their face or if they're drooling out of one side of their mouth, it could mean that they have some neuralgia or numbness in their face and could be a sign of a stroke. A is for arms. I tell people to hold up like they're holding a tray of cocktails or a pizza box in their hand, and if their arm drifts down on one side or the other, it could be a sign of a stroke. Now, I also want to put in there that if someone's got like rotator cuff issues or problems with their shoulder, they're going to have pain maybe, and you take it with a grain of salt. But when in doubt, call 911.
Absolutely.
Yeah, face, arm. So S is for speech. If someone like you and I are talking and we talk pretty normal, I might talk fast, but I think I talk normal. And suddenly they're slurring their words, like maybe they enjoyed happy hour too much, or if they perhaps are unable to answer questions appropriately or acting cognitively like they're not understanding what you're saying, that's a big sign.
So not just Amy not being able to say sauce or source.
No, that's the accent. We're not going to do it.
Yeah, accents aside here, folks. We're assessing speech.
That was good.
And time. I can't stress time enough. And if you're talking about MIs, if you're or heart attacks, if you're talking about stroke, if you're talking about sepsis, time is so significant, but time got even more significant with strokes because of the thrombectomy procedures I was describing. In the past, they only said that we had like a 6-hour window to do a thrombectomy on a patient that was experiencing a large vessel occlusion. Current research shows that up to 24 hours from an initial stroke infarct, we can perform a thrombectomy and still have a successful outcome.
Well, and there's a medication, too, that they can give.
There is, and it's super time sensitive,
of
course. So that drug is called Alteplase, and that is a clot-busting drug, and they give it through an IV. And essentially what it does is it works to break up the clot in the brain so that blood flow can return to that area of the brain. Of course, that drug can only be given, we like earlier the better, but 3 to 4.5 hours outside of the person's last time known well. The last time known well is all we talk about with stroke, because if it's too far out, certain things the patient won't be eligible for. So knowing when a patient was last seen normal is significant. We've gone as far as like going through their phone, reading text messages, seeing when they were able to text, or asking them, what were you watching on TV, and pulling up the TV guide, and oh, you were normal when The Simpsons was on. You know what I mean? Like anything we can do to get a last time known well, because it's going to determine how we can help that patient, because if they're out of a window, we can't do anything for them. So knowing the last time known well is the most significant, but I'm about to confuse you.
No, this is very interesting, but so important. So, and again, let me just say, if anybody has questions that we're not answering, even though you're giving us so much information.
Or if they're confused about something.
Yeah, because I'm sitting here like, wow.
I jump around a lot. But FAST, the acronym FAST, has been used for stroke, I feel like, forever, and it's what people are most familiar with. But they added something to the FAST acronym to catch different types of strokes that we were missing in the past. So instead of FAST, they're telling us be fast, so BEFAST. And the B stands for balance. So you're looking for balance and coordination. A lot of times, some of our friends come into the emergency department and say, I hurt my toe. And we're all concerned about the toe. You fell on the toe is jammed, we broke the toe. But we were forgetting to ask the question, why did you fall? Oh, well, I'm dizzy and I'm uncoordinated and I can't.
Right.
And then it's like, oh, well, when did that start? Oh, it started at 7:15. You know what I mean? And then you get the story and you're like,
Right.
You're having a stroke. So adding that balance, and then E for eyes, we're thinking about double vision or visual field cuts. So patients who have double vision in conjunction with any type of dizziness can be a dead ringer for a posterior circulation stroke, so a stroke that's happening in the back of your head. It's a stroke that we miss because patients
Right.
come in with vague symptoms and we assume it's vertigo. Oh, you're dizzy. Like, you got vertigo.
Yeah. And I'm going to excuse you.
Yeah.
Just, you want to at least, we can announce that phone number. I said, if you have any
yeah,
questions,
yeah.
call in. So feel free to call in at 188. I always have to count those 888s. 441-1580 or directly at 206-1580.
That's why I let you do it.
Yeah, because I'm like, but see, there is no shame in my game. I'll be like, okay, I got to count on my fingers 3 8. So it's all good.
I was really impressed because I thought you memorized it, but then I saw it is
Oh,
posted
you're
here.
not supposed to tell.
Oh, it's not supposed to.
I'm
You totally
joking.
memorized
no,
that?
I am joking. It's fine.
So to confuse you all a little more, in addition to the FAST, if you can remember the BE at the beginning for balance and eyes, it helps us better identify where the stroke might be, and always knowing when symptoms started is the most significant. But don't let me get off track, because I think we were talking about sepsis.
Well, no, and it's okay, because I'm sitting here like, wow, because this is good information.
Sure.
Because really, if somebody's feeling a little lightheaded or dizzy, I mean, it could be numerous amount of things.
And strokes don't necessarily have an age limit either.
Oh, no, and that's, unfortunately, is very scary. Younger people are having strokes.
Yeah.
The demographics of our country and the makeup of our country is changing, and people are diabetic, and people have high blood pressure, and people, just our environment as Americans, we all have Roombas. I have a Roomba. Don't judge me. I have a Roomba. And I love her. And, we go through the drive-thru and we grab a Big Mac because we're busy and we're not meal prepping our lunches and we're not, counting calories, and we're just living our lives. And America makes that easy because everything is readily available quickly to us.
And it's on sale.
And it's on sale and it's cheap.
That is true.
Younger people are having strokes because they are more comorbid than ever, which means they have other health conditions that put them at higher risk for having a stroke. There are some things that put you at risk that you can't change, like your gender or your race or your past medical history or your family's medical history. If your mother, brother, and dad all had a stroke, you're going to be at higher risk for a stroke, and that's not your fault. If you smoke, drink, don't exercise, and you're overweight and you have high blood pressure and you don't take your medications, those are things we can help. Those are things we can change. So we always try to tell people, let's work on your modifiable risk factors. And that means knowing where you stand, knowing what your cholesterol level is, what your blood pressure is, what your health status in general is, because we're not always good at following up with doctors. Even I'm not.
But I did hear that, and I don't know where I heard it, but that we're having less of the big strokes and more of the little strokes.
But here's what's so scary about that, and we talked about it a little bit before we came in here, is that the biggest indicator of a massive stroke is the mini stroke or the TIA that comes before it. It's like your body's warning sign, like, hey, the big one's coming. Get yourself under control. Like, if someone is diagnosed with a mini stroke or a TIA, that is like the biggest knock on your door of it's coming. Like, get ready. The big one's coming.
Okay.
So getting yourself, in line with what is recommended by your healthcare provider is significant for stroke, because a lot of the things we can mitigate. I think I read something like reducing your sodium intake by 400 milligrams a day will reduce your chances of stroke by like 50% or something. It's like, gosh,
Wow,
you know.
that's big.
But I could have made up that statistic. Someone should Google
But
it.
even
Somewhere
if it's
around
lower,
there.
yeah, this is information. Like, you guys have
So-
classes on this? Like,
Yeah.
I mean,
Well, I mean,
people would want to know this, like, how to
Well, I
help
think
prevent.
one of the doctors we've had on the show, I don't remember the exact number, but they said it's not that big of a change. It may be eliminating, a little bit of the salt. Just have a little bit of salt on
Yeah.
the food,
Right.
Or just not putting extra salt on your
And
food.
in
Right, 'cause
moderation,
it has-
everything, yeah.
Because you'd be surprised, all the foods, they always say shop the outside of the store. There's, on the inside of the store, the inner parts of it, most of the foods and processed foods are loaded with sodium.
Yes.
it's torture. And I've actually personally started doing like a grocery pickup where I have to like pick my groceries before I get there. And not only do I spend less money, but man, I feel like my food's healthier. It's like
Because you're not saying.
I'm not searching for the chocolate covered
You know
pretzels.
what?
Or
you
put
know?
that
the Lay's
is a
in my
good-
bag.
Yeah,
I
exactly.
didn't think of that. That is a really good point.
It's really
Yeah.
nice, and
Well,
then I
yeah.
don't have to like get dressed on Saturday and go to the store.
Well,
so it's
and
really
the
great.
grocery stores are designed for us to buy the
course.
things
Well,
that they want us
that's the
to
whole
buy.
point,
And
yeah.
Yeah. So there's little, I mean, that's just me personally. That's not recommended by any
No, but
physician.
that
who wants
is
to do a
that's
grocery
a
pickup.
good recommendation. Especially you ever go to Walmart, I buy stuff like not that
I
I,
know.
don't need, but everything and anything.
well,
you
and
know?
then you're frustrated because your blood pressure's up because you're at Walmart.
yeah,
That's true. And parking at Walmart and finding a cart at Walmart can be a little
Getting
difficult.
down the aisles.
And then by the time you
That's
get
a whole
home,
other show.
you
Yeah.
have like nothing that you need to make a meal, and you're ordering a pizza. Because
And then
you
you're
didn't buy
like,
the
how
stuff
much
you-
money have I spent?
I know, it's
But-
torture.
And
But
but
on
then
the
there's
outside, walking Walmart is good exercise.
there you go, and it's convenient. You
It's
got to think of it that way
truly-
because you can get
Everything's
a lot.
there.
Yeah,
And
and their prices are good.
We are not sponsored
Yeah,
by
right.
Walmart.
Yeah, Walmart is not our
Walmart,
sponsor.
Publix, they're all good.
Yeah. So what were we even talking? We were talking about.
Sepsis.
We were going to talk about sepsis.
Okay.
So sepsis itself is it's not a disease. It's a progressive inflammatory condition as a result of an infection. So sepsis happens when the host or the body of the person who has an infection becomes overwhelmed, and the infection will literally take over the person's body and shut down vital organs. So yeah, like it sounds like something, your great grandma would get, right? But
Right.
what's scary is sepsis can affect infants, young people, middle-aged people, or old people. It's across the spectrum. Everybody's at risk. Obviously, the more risk factors you have, like comorbidities, like if you have an immune system issue because you're getting cancer treatments, or if you have diabetes, or if you have liver issues, it ups your chances of developing sepsis. But anybody is at risk. In our community, the demographics seem to be men between the age of 60 to 65 is our highest population of
Really?
sepsis cases,
I would
which
say-
is kind of universal though for sepsis. It's men in their 60s.
I would say that's my dad was probably closer to 70 the first time that he went septic, and basically got up in the middle of the night, couldn't walk back to the bedroom. That morning he got out of bed, walked out to the living room, and had a urinary accident on his way. And I said, we have to go to the hospital because he was fine the day before.
Of course,
and
that fast.
Yeah, that fast.
I mean,
he was not fine.
We've seen it happen. Like I've had patients come into the emergency room talking to me and seeming okay, and within 6 hours they are not okay.
Right.
It's that quick. So
Yeah, he could still talk, and
right.
in fact, my mom was like, "He doesn't need to go to the hospital." I'm like, "Yes, he does."
Yeah. Get in the car.
What would be like some of the signs, like
Right.
to know or not, or are they there?
So what I tell people is there's sort of universal signs that we look for for infection in general. So we're looking for a fever, anything over 100.9, but we're also looking for hypothermia, which is anything below 96 degrees. And that, if someone is hypothermic, that means that they are not able to regulate, which means there's
Okay.
something wrong.
Yeah.
So everyone always thinks fever, burning fever. Right? Well, if you're cold too, it's
There's
still a
something
Yeah, I
bad
don't
thing.
think
It's still
my
a bad
dad
thing.
ever had a fever with his.
Yeah, a lot of people don't.
Really?
Yeah,
See?
and the rapid heart rate is the second thing to look for. So a heart rate above 90. A lot of our population is on a drug called a beta blocker, and a beta blocker will keep your heart rate low even if under normal circumstances, if you weren't on the beta blocker, your heart rate would be through the roof. So sometimes that's tricky. If a patient's on a beta blocker, we're like, well, fast respirations or breathing quickly. So anything above 20 respirations per minute is significant for us to look at. If someone is breathing quickly, they're compensating for something. So we are trying to figure that out. And the last sign we kind of look for is a WBC, which is lab work, which you're not going to readily have available unless you just went to Quest this morning and got your lab drawn and got your results, which some patients come in with. I swear, they're like, this is my urinalysis and this is my, but they don't usually have that available.
And just to say, because my dad never fit any of those criteria.
Exactly.
And the first time, obviously, there was something he was having a hard time walking, and he was having a hard time controlling his bladder. But even his urine test never showed an infection until they cultured it.
Exactly.
So
cultures take days.
Yeah, and so they never knew. But
so you just don't know.
I got so that I knew, like
What
I
to
could,
look for.
I knew that he was having a problem and that we needed to take him to the hospital. So if somebody is acting differently than what you're used to, that needs to be checked.
And I'm sorry, I'll be the bad guy again, but we do have to go to break.
It's a good thing someone's responsible.
Actually, it's him. He's on me. We'll be right back.
He keeps us online.
That's just amazing. How?
Yeah, my dad had a chronic urinary tract infection that they kept in, and probably started when he was in
I like
his
to hear how they deal with different conditions.
They put him on a long-term antibiotic just to keep it
sharing.
And that comes with its own set of problems too.
And then it just never,
Yeah, I have to remember to tell people belly, lungs, and urinary tract are the three big hitters that we see for sepsis the most, and those are a majority of our infections. Like we get some cellulitis, wounds, stuff like that, but belly, urinary tract, and lungs, those are the ones that
if
the hardest.
If you're lightheaded and you feel like you're gonna pass out for a moment, dehydration can do that too, correct?
Of course, but come to the hospital and let us rule it out.
Yeah.
And they can
Get
you
a bag
some
of
fluids.
fluid and split. You know what I
Just
mean?
don't take the chance.
Yeah,
right?
that's how I feel. When in doubt, come. If you're wondering, don't wonder anymore. Go somewhere.
Wow. But there's so many times. I mean, people have vertigo, right?
Still.
Yeah, like you just never know. But don't take the chance. Like, you're
That's how I
very
feel.
informative, my dear.
That's very nice of you to say. I'm faking it till I make it.
Well, you're doing a good job of that.
Right?
No, it's just because these are things, I mean, we might not think of course.
Mm-hmm.
You know, I'm thinking more about how am I helping this one for that. But, welcome back. This is Amy Conti with Chelsea Place Senior Care.
We get talking on the break,
And
then
Suzanne,
it's gone.
I know. Okay, and Suzanne with Discount MedDirect. And please call in, feel free. Our studio line is 206-1580 or toll free at 888-441-1580.
She really wants somebody to call
Well,
us.
no, I just
counted the
think,
eights. I saw one.
I did good. No, it's not even about just calling in. I mean, we have Lauren Sutherland. I have to look at your last name.
It's okay.
And with Fawcett Hospital and these things you're educating us on, I'm just like in awe. Like, wow. That's why I was like, maybe people do have questions, but it seems like you're giving us information before I can even ask you a question. Like, it's so thorough.
Lauren,
it's
is there a
amazing. Thank
main
you.
number if someone had a question that they could call the hospital, or is it better just to come?
Well,
Well,
I
it
really,
depends,
I
I'm
never
sure.
want to tell people, well, like, call me first and I'll tell you whether or not to come in. You know, there's a little bit of liability that goes along with that. When in doubt, call 911, get to a hospital. If you're ever nervous that you or your loved one is having a problem, I always encourage people to come because it's much better to come visit us and you hang out and then we say, nope, you're fine, bye, have a good day.
That's
And
absolutely
then
true.
come in when it's too late. And because, like, how many times have I heard about people, oh, well, my dad woke up, he said that he wasn't able to talk and he wasn't feeling well, so he laid down and took a nap, and now it's a day later and it's like, oh, this guy had a stroke. And,
Right.
you know what I mean? So I always just tell people, when in doubt, come in. And we were talking just a moment ago, you know, it doesn't always have to fit the exact clinical picture that we're assuming when it comes to sepsis or for stroke. Someone not acting right is a great sign that something is wrong. So if you know somebody and you know how they act on a day-to-day basis and suddenly they're not answering questions correctly, they're fatigued, they're not firing on all cylinders like you're used to, something could be wrong. So I encourage people to seek medical care if
and especially with that infection when it gets septic, they can act kind of crazy.
They do, and we were talking before, the most common sites of infection that lead to sepsis are the lungs, the urinary tract, and the belly. And when I say the belly, think of anything inside that belly that can bust open, get an abscess, get something in it, any belly organs that can grow anything or open up. Those are the fastest. Those are the ones that you see that if there's a perforation or free air in your belly, you wouldn't know that unless you came in. But new pain is never normal. Sudden or new pain is never normal. So I tell people, like, if you are suddenly having specific pain in your belly, don't hang out and wait. Just come in and see us. Because we'd much rather send
I think
you
a
home.
lot of people, if something happens, you're like, especially some people are stubborn.
Yeah.
Oh, it's nothing.
I know.
But nothing can be something, and why take the chance?
Well, and we talked about with the veterans people about that age group, that World War II, Korea guys, and even the women of that age, that they're just kind of trained to be like, no, I'm fine, and that's totally my mom, and
and that's constant. Or or you have a man who is just. No, I'm all right.
Yeah,
we're too tough or whatever. But yet, you know what?
But as
you
a
just never know.
if you're a caregiver and that person is not like they normally are, take them in.
Absolutely.
Take them in,
Don't
call
take a
911,
chance.
whatever you need to do.
And just like I mentioned before, heart attacks and stroke, I really beat it into everybody's head. It's very time sensitive. We need to know times for everything. It's the same with sepsis. Once you roll through the door and we flag you as someone who might be septic, it's like a cascade of events that happen, and it all has to happen within an hour of you coming in to see us.
Wow.
So we hold our staff to a really high accountability level to treat these patients quickly, because the evidence has shown us that the faster we treat you and get antibiotics in, it reduces mortality. So some research came out that said, listen, if someone is septic and you don't give antibiotics for some reason, maybe you haven't gotten a lab back, or you're waiting on a test result, or you're waiting on a radiograph to show pneumonia, whatever, every hour you wait increases your mortality by up to 8%. So, I don't know about y'all, but I want every minute.
Well, absolutely.
TikTok.
Well, and I know when my dad ended up septic the first time, my uncle Googled it because, we didn't know he was at the hospital, but we Googled it just to see what it was. And it said 3 days.
Yeah.
Like that.
That you had 3 days.
Well, basically, once you're septic, you can die in 3 days.
Mm-hmm. I know not to sound like off, but is there also an odor that comes with that? And the only reason I'm asking, because this is related to an animal we had that became that way, septic, and it's just not to compare, but it was my daughter's rabbit.
Oh, we love bunnies.
Bunny rabbit,
I
and
never
it
noticed
became
an odor.
that way. And when we had to decide to say goodbye, there was a very odd odor coming out of the pet, and I'm like, not compare. I mean, we're all
folks,
animals in one way or another, but no, I'm just curious, because I know with a urinary tract infection, you do get an odor as well, but just so it's an alarming, hey, I know maybe something's going on.
So as a nurse, things like odors don't scare me at all. That's the weird part about being a nurse, right? People come to you with rashes and smelly things and ugly things, and we're like, cool, I want to see. So not such a weird question, actually, but color, odor, consistency, and amount, COCA. So odor is something to consider when you're talking about infection, and the odor can come from anything. It can come from a wound, it can come from urine, it can come from something coming out the other way. I don't want to be talking filthy on the radio here. As a nurse, I'm not grossed out by it, but some people can be. And different, different types of cooties, they do smell different. So
but I mean, just like as a sign, like maybe you're,
you should start a research project and see if
no, it's okay. But no, I know once when I came into a situation where somebody did have a urinary tract infection, they they did have, and that's when I was educated. Oh, you must get this person to the hospital very soon because they need antibiotics.
But
I
again,
would never
that
have
isn't
known.
specific
So
symptom
it's not.
because
That's
my
why
dad,
I'm asking.
My dad
No.
never had an odor.
No, but
Yeah.
we do
So
tell
no-
people.
just
And
a
his
question.
was
Yeah.
urinary tract related.
Yeah, I mean, we tell people, like, if it's different and it's not your normal, like, if your
something's
urine
up.
smells different, like,
Yeah.
yeah, it could be something going on, or it might smell, I don't know who's smelling it, but maybe it smells exactly the same.
Well,
It's
and
I
just,
get what you're saying.
different
I get what you're
signs. I don't
saying.
mean,
Yeah.
and I'm
But
not,
yes.
I don't mean to use a rabbit compared to a human being, but
If your
that's
loved
what
one
they
smells
told us.
weird, take them to the hospital.
Well, and it depends on who it is. No, I'm only joking. But no, I just because of signs we
Yeah.
might not see. Like I know somebody who, had some indigestion and there was something else going on and they were
Well, that
sent
goes
home.
back to her. Her
so,
same three things: urinary
so
tract,
just be
belly,
aware.
and lungs.
Yeah, that's
just a
what those are the
question.
big hitters for sepsis. And like I said, Fawcett is part of HCA, and HCA really kind of decided that sepsis was going to be a main focus for them because it was a great opportunity to do things faster and get better outcomes for our patients. So at Fawcett, we are aiming to find sepsis quick, treat it quick, and make sure that we do the right thing so that you're in and out and sailing out and getting back to your boating, your bocce ball, lunch with your friends,
Yes.
whatever it is, because we don't want you hanging out with us. We want you to be enjoying life. But if you don't come to us in time, it messes up our game. So we would like you to
And could
come.
mess up yours.
It can mess up, yeah, and it can mess up yours. I'm probably creating a bunch of hypochondriacs now. They're like, oh my gosh, this is
That's
wrong.
okay.
This is
Yeah,
wrong, this
but
is
we
wrong.
have to just be
you're
aware.
guaranteeing
You
your
can't
job.
live.
Yeah, right. Yeah,
Live in
truly.
fear. Just be alert and aware.
Sure.
Otherwise, if we thought about everything, we would all probably be in a corner of a room hiding.
Well, that's
But
the problem
this is-
too with working with a hospital. At the hospital, like my office is in the emergency room, so I'm like, what is this? Like, do you think? And should I get and whatever? And they're like, maybe you should see a doctor. I'm like, I'm not seeing a doctor. I'm
But
fine.
yeah,
I'm
you see,
whatever.
it's like that. The painter's house is the last to
Always,
be painted.
always,
Yeah.
always. Can you think of anything else? for me?
This is just like amazing information to be educated on, and so if anybody is
Well, is there a number? Say
I
someone
was gonna
remembers that we
say.
talked about an acronym and they can't remember it.
Always.
Is there some place that they should call you to get that kind of information?
You
Just
know-
general health information or classes that Fawcett might be putting on or
online,
seminars
or you need to now.
No,
No,
really. So I'm always trying to get out into the community. Any opportunities I have to come and talk to the public about sepsis, and I know Jan, my counterpart, likes to go out and talk about stroke. So we're always inviting ourselves to various events, or even the local community SNFs or rehab facilities. I've hung out there a couple times and talked to their nursing staff about sepsis and stroke in the past. If there is a specific question, and I'm not saying like a triage line or anything like where you're
Right.
saying like, should I come to the hospital if? I always just encourage you to come if you're in doubt. If you wanted to call the hospital's main line and ask for me or Jan if you had questions or concerns, they could get you to our office number, and our main hospital number is area code 941-629-1181, and our operator will pick you up. And if you asked for, can I have somebody in the quality department, they're going to lead you to us.
Right. And I mean, I'm sure everybody in the area would know where your hospital is, but just in case.
Yeah.
Yeah, just in case.
If they want to
You're
drive
like, over the
themselves, even though
bridge.
you've told them
Stop
911.
driving yourself. So, and plus, it's kind of fun to drive. Well, not fun if you don't feel good, but driving in an ambulance, I don't know if you guys have done it lately, but they get to break all the rules in the ambulance. So I encourage you guys to take, if you can do a ride along with one of the stations, one of the busier stations. Any chance I get to ride with the guys, I'm like, can I come with you guys? And it's a good time. They get to run all the stop signs, all the red lights, so they're going to get you where you need to go quickly. But Fawcett Memorial Hospital, we're located in Charlotte Harbor on Olean Boulevard, so it's actually kind of like in the heart of town, really, right off of 41. And you can't miss us because there's cranes and there's all kinds of bulldozers and things all around. So right on Olean, you literally can't miss it.
And I'm sure there's a lot of good information on your website as far as like the acronyms and health information. So give us the website in case we have some technical people.
Right, FawcettHospital.com. So for those people who frequent online, which, if you ask like my mom, who I think is a young and vibrant woman, she can't even send a text message. So I don't even know. There are some folks out there who like to go online and take a peek. We're at www.fawcetthospital.com. And for those patients or folks out in the community who want to participate in our stroke support group, we have a stroke support group the last Friday of every month at 1 p.m. And that's where patients, caregivers, family members, people who are interested can come. We try to do like cute like cooking classes, rehab information.
That's
like
great.
It's nice, and really like they're friends that just want to get together and hang out because they all know each other for the most part, but we're always looking for new people who might want to come to that. I'm trying to think of what other events besides the ribbon cutting we have coming up. I'm probably just going to have to reach out to Alex now and say that we need to have a sepsis stroke lunch.
Yeah, and actually you can, I mean, I know you do things through your HTU program,
Yeah.
and I would love to partner with you at Chelsea Place to hopefully to sponsor or, I mean,
Yeah.
open this to the community, some education.
Sure.
That's great, because we have a lot of people, especially in the evening, who work during the day and they can't attend the daytime classes. So, I mean, I just thank you so much.
Oh,
This
that's so
was
nice
some
of you.
very, very good
Like I
information.
said, I'm
and
thankful they let me out of the office.
and kudos to everybody. I mean, just the experiences I have dealt with Fawcett. I mean, unfortunately, I mean, it's a nice thing when you have to go to the hospital and have a baby, but that's, my past.
Yeah.
I'm done with that part. But again, business, family, I mean,
And I
thank
have
you.
to say, I don't
Thank
live
you.
in Charlotte County, so I haven't had experience with Fawcett, but, I'm familiar with
really
the facility.
very
yeah.
good.
You can come visit us anytime. Not as
Yeah.
a patient.
Yeah, come
as a
have
friend.
lunch too
Yeah,
and say
come as a
hi.
friend.
I
Thank
actually
you
heard
very
somebody
much.
years ago that she was trying to lose weight, so she, instead of going to McDonald's or whatever, she was an outside salesperson, she started going to hospitals and eating lunch because she felt like the food was healthier.
I'm going to say something.
Theirs is
Fawcett
very
Hospital
good.
has awesome food.
And she said it
And
was
they're-
usually less money than...
It is. It's
Yeah.
very reasonable. I hate to say it bad, but even their pizza, those
I
individual
know,
pizzas
they're
are so good.
Listen,
but
come have
it's
lunch with
great.
us.
Yeah.
All right, and we have to wrap it up. You have been a delight. Thank you so very much. Again, I am Amy Conti with Chelsea Place Senior Care. We have a daytime activity center in Port Charlotte for seniors, private duty home care, and an assisted living. Please feel free to call me directly at 941-787-0687 if I could be of any assistance.
And I'm Suzanne with Discount Med Direct, 2414 Tamiami Trail, Unit 1. Our phone number is 941-421-7155. And we have lots of products on sale, CBD products on sale right now. So if you're in the market, step in and see us.
And thank you for listening, everybody. Have a great day.
Perfect.
Sorry, I
okay.
gave my number, not Chelsea Place, because I had to look for a minute. There's so many numbers,
When you
which
were
is
like,
good.
what's Fawcett's phone number? I'm like, shoot, what is Fawcett's
That's
phone number?
awesome.
I know, I'm sorry. Can you turn it off,
Okay.
please?
Let's see how
Would
this
you guys be
works.
opposed to taking a picture with me? Alex wants to put it on Fawcett's Facebook.
No,
Would you
absolutely
mind?
not, and I'll
Okay.
take one too, even though this will be on our Facebook page.
You know what I realized? My husband's grandma goes to adult daycare at Chelsea Place.
Really? Oh,
At Sutherland.
see that?
Okay, yeah.